now I have the pleasure of introducing our two speakers from, oops, that's my dog, I'm sorry, from Ridgefield Visiting Nurse Association. First is Gigi Weiss, who is the Director of Rehabilitative Therapies at RVNA Health. She manages both in-home therapy programs as well as outpatient therapy at our Rehabilitation and Wellness Center in Ridgefield. She has been with the RVNA Health for over 10 years. With her extensive experience in rehab programs, including working directly on RVNA's Otago fall prevention programs, she's going to help us dive into the facts behind falls and strategies to help us to reduce our risk. I know falls are something that everyone is terrified of. The next speaker is Melissa Woodhouse. She is the director of the StayWELL Non-Medical Services. She has been with RVNA for 6 years. Melissa oversees the in-home personal caregiving services and the Philips Lifeline Medical Alert Service. And as an occupational therapist, she brings significant experience to the topic of safety in the home. She will also be reviewing proactive steps that we all can take in our own homes to reduce the risks of falls. And with that, I turn it over to RVNA.
Okay, so hi, I'm Gigi Weiss. I'm a physical therapist, and like I said, I've been part of RVNA Health for over 10 years. Just to kind of start a little bit of our agenda here, we're going to talk a little bit about the statistics of falls, kind of the science behind the fall risks and how things increase, how to know when you're at risk. There's a little scale we can give you there, and some strategies to reduce falls, which is what Melissa and I were both going to talk about. And then after that, we're going to do some questions and answers. So just a little bit about statistics of falls. So when we made this slide up in the top 10 causes of death among older adults has always been heart disease has been the first, cancer, respiratory disease, stroke, Alzheimer's, diabetes, and number 7 is kind of where that fall comes into place, which is the unintentional injury, and the fall is the top category of that. And then behind that is influenza, pneumonia, kidney disease, and Parkinson's disease. So it is definitely one of the top 10 reasons of death among older people. So again, with statistics, it is found that an adult falls at least one fall every second in the U.S. So in 2015, more than 1 in 4 adults kind of reported a fall. And from here, what this is showing is that during those stats, 36 million falls, you had 8 million injuries, which and there was 6 million emergency room visits. And from there, there's 950,000 hospitalizations, and from there, there's 32,000 deaths. So that's kind of how it kind of breaks down. 95% of falls, of hip fractures, are due to falls. So that's just kind of one of the statistics that could be a result of a fall. Also, another leading cause of injuries is traumatic brain injury. That's if you fall and you hit your head severe enough, you can cause a brain injury. It also increases your risk of any kind of nursing home or long-term placement. And fall death rates increase about 30% from 2009 to 2018, were all as a result of a fall. So just a little bit how we, as we age, we have a more prevalence of chronic diseases, which kind of increases the use of medications. Some of these, typical diseases are, cardiovascular diseases, COPD, which is breathing, cardiovascular, depression, arthritis, even thyroid, diabetes, all these kind of things that you're taking these medications for can increase your risk of falling by 30%. And also, as we age, we lose strength, we lose endurance, we lose muscle mass, reduces, physical activity. So that all increases your risk for falling. So as endurance and strength, there's a 10% increase in risk. As your muscle power, you have a 30% decrease in muscle for every decade of after the age of 30. So after the age of 30, our strength goes down 10%, our muscle power then goes down 30%. So 30 is kind of like the turning point, unfortunately, for everybody. And also increased fear of falling. It kind of reduces your physical activity. So sometimes it's a fear factor that can also contribute to your falling. So these are some kind of key risk factors. So it's kind of they're all kind of intertwined, and they can start with just basic problems with walking or moving. If you have just basic arthritis, that could be a risk. If any kind of postural hypotension, which means low blood pressure, a change in blood pressure as you change your position, that's postural hypotension. So those, we've all maybe could have experience of standing up from a chair quickly or getting out of bed quickly. All of a sudden you feel that lightheadedness. A lot of that could be a result of postural hypotension, where your blood pressure suddenly drops. A use of 4 or more medications, they say that, like kind of what we discussed before, can also lead to falls, because sometimes there's interactions and those other issues with those. Visual problems, it's very important to make sure that you keep up to date with any sort of vision appointments. So visual problems obviously can cause falls. Home hazards, which we'll talk about, is a big leading of falls, and unsafe footwear. So all those things are kind of some key, easy things that we can change for falls. What this chart is just showing is that as those risk factors increase, so does your chance of falling. So if you have like one of those risk factors that we just showed, you have an 8% chance of falling. If you kind of have 2, it's your risk factor goes up to 19%, and 3, 32. So as any of those risk factors increase, it kind of increases your risk for falling. So this is kind of that self-assessment you can take. If you look at the questions, it's just 10 kind of easy questions. Have you fallen in the past? Do you use a walker or a cane? Do you, sometimes you're unsteady? Do you use furniture to help you walk? We call that furniture walking. Like we said before, just kind of worried about falling. Do you have to use your hands to get up out of a chair? Do you have trouble stepping up onto a curb? Do you often have, you must, kind of feel like you're rushing to get to the toilet? Have you lost any feeling in your feet? The medications that cause lightheadedness, if you take medications to help with sleep or mood, are you feeling sad or depressed? So this is kind of a this is from the CDC website. It's kind of a it's part of their STEADY program, self-assessment. And if you answer kind of 4 or more yeses to these, or just give it a little check, it does increase your risk that you may be at risk for falling. So it's just a good little self-assessment for you to take a peek at. So what can we do? There's quite a lot. So one of the things that we talk about always is regular checkups. It's very important that you go to your regular physician and just talk to him. And if you do have a risk, if you feel like you have a fall, if you've fallen, or you feel like you're at risk for falling, to make sure that you mention that to the physician. And it's a good opportunity to review your medications, make sure that the doctor discusses the side effects with you. If you're unaware, you might not realize that a certain medication kind of makes you dizzy, and you should maybe take that, or make you lightheaded, take that at night when those kind of things. It's also good to discuss just any kind of supplement to bone, bone support, muscle support, nerve health. All those are really important to discuss with your doctor. Discuss your feet. Any specific issues that you have. Some people don't realize that they're not have good sensation on their feet, so it's really important that you have that discussion, or that you notice that. And then specific footwear, and we'll talk about that a little bit, is really important, that you're always wearing good footwear. Balanced meals is really important. You really make sure that if you can, it's better to kind of eat, little meals throughout the day than not eat breakfast and lunch, because it really does make a difference as far as how your body metabolizes, and that can contribute to falling and lightheadedness and dizziness and all that. And then, like we said, general eye exams, and again with the make sure that you keep those if you need glasses, make sure that you keep the prescriptions up to date. So a little bit about footwear. It's amazing when we go into people's homes to see what they're seeing. I always say you really want to wear in your home a indoor shoe. Slippers are not good for being in the home, especially if they have to have a good sole on them. So it's better to have an indoor shoe in your home, and that has a good support. So nothing, and then for outdoors, obviously, they stay with the snow, a nice solid boot if you do venture out. But, in the normal weather, just making sure a nice supportive non-skid shoe is very important. If you do use a walker or a cane, that's fine. You just want to make sure that it's fitted correctly to you. So these are just two pictures of making sure that your walker or cane, these are the ideal positions where you're standing up nice and tall, that you just drop your hand at your side, and the curve of the walker or the top of the cane should just fall right at your wrist. So, so it just kind of it's important that you do fit things correctly. I know some people kind of like things higher and lower, but this is the ideal fitting for walkers and canes for everybody. So like we said before, really important to avoid rushing. So take your time. I think sometimes people, like we said, if you have to rush to get to the bathroom, but if you can, that's usually when falls happen, is quick movements, quick jarring motions. So just kind of, nothing's that important, but to really just try to avoid rushing and take your time for anything that you do around the house. And exercise. So in general, good bone health, good muscle health, all that is important to maintain, just generally good health and preventing falls. The stronger we are, the more our body can react to any sort of change. So regular exercise, and I know it's tougher today, but there are a lot of in-home things that can be done. Obviously, we're not going to be going out and doing step classes these days, but there are some things, and I'm going to show you some simple things that you can do in your home for regular exercise. Once the weather clears, walking programs are great. If generally you can do, they just say up to 30 minutes 2 times a week, and this can be broken up. So even in your own home, it's just good if you can get up and walk around for 10 minutes. Doing that and make it into 3 10-minute routines are really important. If you're able to, doing the stairs are really good. Just an easy exercise to do in your home, to go up and down the stairs. It really builds a lot of good strength and muscle and bone strength. So ideally, once the spring comes, once we're able to get back out there again, working your way up to a good 30-minute walking routine, at least twice a week, is great. But like I said, it can be broken up into 3 10-minute walks throughout the day. These are some really easy, basic really good overall exercises. So these we call our sit to stand exercises. It really helps build the strength in your legs. It improves your body mechanics, and it does help your balance because you're dynamically moving. So it's a, you know, sitting at a sturdy chair. It's always good to have something in front of you. You don't want to do this from a, you know, a low sofa. You really want to, if you can find like a good dining room chair or something like that. And ideally, you want to work up to being able to sit to stand without using your hands. But if you need to start by pushing up with your hands, that's fine. The ideal position to work yourself up to is finding yourself a nice dining room chair. You kind of scoot yourself forward, you get yourself positioned, you lean forward a little bit, you keep your chest over your toes, and you slowly rise into a standing position. And you sit back, sit down slowly. Sometimes we do like a count, like maybe you want to sit down in like a 3-second count, 1, 2, 3, and then sit rather than plopping. And then you try to repeat that over again. In general, if you can do these at least 2 or 3 times a day, trying to do 10, you know, doing 10 reps of them, it is a great exercise because it helps your feet, it helps your ankles, it helps your quads, your legs, your thighs, your butt muscles, and your balance, because once you stand up, but it's good to have a little table in front of you. So if you stand up, you need that balance. You've got something there. You can even do this with a walker in front of you. If you have a walker, much better. Have something being on a firm chair and standing up with some support in front of you. And it's a great simple exercise to do in the house. So you can kind of, you know, break up your day by doing some of this. Another one, nice, simple, kind of easy exercise that you could do in your house is for balance and strengthening, is kind of like the sidestepping exercise. So basically, again, you get yourself at a countertop. This is great if your kitchen counter or dining room table. You stand up with your feet shoulder width apart, kind of at the countertop, and you kind of sidestep, you know, to the one side. And then you kind of lift your hands up for a little challenge, and you put your feet together and then put your hands down. And then you sidestep to the other way, and you get your feet together, you lift your hands up, and then you put your hands down. As a next progression is that last picture, which is kind of where you sidestep and you kind of lift the one leg up, and that helps your balance. And then you put the leg down and you sidestep and you lift your other leg up and you put your, so that last picture there is kind of like the final progression. You can work your way and move your way up. So these are just some really simple exercises that you can do in your own home, at your own, you know, kitchen, dining room area, that are, you know, relatively safe and really good functional strengthening and balance exercise. So what we have, there's another way to, you know, there's the physical therapy. If you feel like it's not something that you can do at home and you need some, you know, kind of some guidance, you know, there are physical therapy is definitely something that is an intervention. We do this, it's called an Ontario Balance Program. It's actually out of New Zealand. It was an evidence-based program out of New Zealand. And it kind of combines a lot of those exercises that I talked to you, that I just showed you, is kind of part of that program, but it combines flexibility, strength, and balance. And it's a program that increases, you kind of start with the 2 sets of repetition, and then you move on to, you know, supported, which is with your hands down, to unsupported exercise, which is with your hands up. And again, it's a nice program because it's really based on just 30 minutes of exercises that can be divided up over the day. It can be divided up into 3 different 10-minute segments if you need to do that. There's 3 times a week. And there's a whole course of exercises that start in sitting, then they go to standing, and then they go to dynamic standing, which is, you know, moving. So it kind of it's a good little stage as progression as you go through the program. And that's it. That's and now Melissa's going to talk about some of her favorite things, which is home safety. I like that too. We both like home safety.
We do, true, we do. I'm Melissa Woodhouse. I'm the director, as mentioned, of the StayWELL Non-Medical Services, but I'm also an occupational therapist. And like Gigi said, home safety is one of our favorite topics, working in home care. And we're going to go over just some simple things that you can do. There's a lot more complex home modifications that you can make as well. And if you're interested in knowing about that, you could always reach out to us. So for starters, stairs and steps, simple things, keep objects off the stairs. I know, people like to put things there to maybe bring them up later, but think about where they are. Are they in your way? You want to keep them out of your way. You want to fix loose and uneven steps, that step that you've always said creaks, or maybe the, handrail that has always been a little wobbly, now's the time to fix it for sure. You want to repair any loose or torn carpets, or or use non-slip rubber treads. That's also a great thing that you can buy. They're not very expensive, and you can put them on each step. Handrails on both sides, so simple, but so helpful. As you can see in this picture, having both hands when you're going up the stairs really supports you in a much better way. So that's a simple thing you could do. Lighting, you're going to hear us talk a lot about lighting in this presentation, but lighting is essential. If you can see where you're going, you're likely to not fall. So you want to make sure that there's good overhead lights. You can install motion sensor lights. Those are pretty, cheap to get. Home Depot or any of those kind of stores. Put them at the top, at the bottom. You really want to increase your visibility. And as mentioned, installing the second handrail. Floors, you want to keep the walkways clear of any sort of extra stuff. You've got closets for a reason, right? So keep it out of your way when you're walking. I don't know how many times we've had people fall just from a box that was, on the floor. Remove or affix rugs. Another really common thing when we go into people's homes. Nobody wants to get rid of their throw rugs, and we understand they're beautiful and they're there to keep your house clean. But again, we've had so many people fall just from sliding on their rugs. So, put some sort of non-slip material underneath, or, some people have even glued them to the floor, nailed them to the floor. Whatever you have to do so that they're not moving is really helpful. And on the edges, if they're rolled on the ends, that's another place where people will trip. Maybe it's time to get a new rug, a good excuse to get a new rug. Think about those rugs. You want to clear or tape any cords or wires in the way, just to make sure that you're not going to trip on those. And again, lighting, so important in your hallways. You could put those little motion censored lights. I have these really cool lights that if the power goes out, they turn into a flashlight too. So they've got some really great ones that are motion censored, and you can just stick them in all your outlets. The kitchen, you want to think about, where's the things that you most commonly use stored? Those big heavy pots, can you leave them on the stove because you use them a lot? Can you put them in a lower shelf so it's not that hard for you to get to them? I like a kitchen that looks used, right? So it's helpful to have them in a place that you can easily access them and not fall if you're bending too far down or if you're reaching too high up. Avoid using a step stool. It seems pretty simple, but it's definitely something you want to do. So that's why you want to bring everything to a level that you can get it. Step stools, as commonly used as they are really not safe. Clean up any spills immediately. You want to keep, a towel or a Swiffer handy. Swiffers are so great. Can just toss that cloth off. You can just take it off, toss it away. Really easy to clean up a spill. Bedrooms, again with lights, you want to make sure that your light is near the bed so that you don't have to get up. You can just tap on it or turn the light on. And sit at the edge of your bed for a little while before you get up. Just like Gigi mentioned, there's something called orthostatic hypotension that people don't realize when it's dark. When they sit up quickly from their bed, you might get a little dizzy, and then you get up and you might fall from your bed when you go up to get to walk. So it's important to have lighting when you first get up from your bed and to sit, give yourself a minute. You want to clear the pathway from your bed to the bedroom, no laundry baskets in your way. That's really important. Most of the time people fall at night, so we want to make sure that everything is safest at nighttime. Consider installing a bed rail. If you see this picture here, it's really simple. There's a lot of different companies around. There's Senior Depot right by Costco. There's medical home care places that you can buy these. You can get them on Amazon. Really simple thing. You can put it right on the edge of your bed. There's even like a little pocket you can put your phone or if you have a TV remote, you can put it in there. And it just helps you get up safely from your bed, or even move around in your bed if you want to move to your side. Some of them, they even swing down. This one, it looks like it does. And then you want to move your phone within arm's reach of your bed too. Again, you don't want to have to get up and get something. You just want everything accessible, easy for you to get. Bathrooms, like this is top on the list. A wet, slippery floor is never a good situation. So you want to put non-slip mats or strips in the tub or the shower. You can get those on Amazon, Kohl's, really, really easy to get. And you want to make sure that you have those down. You want to install grab bars by your toilet or your tub. If you see this picture here, there's some grab bars in there. They have ones that you can actually put in, have someone install for you, but they also have ones that are suction cupped, and you can put those in your bathroom. They're nice. They have like a little indicator on it. If it's a good seal, it turns green. And you want to make sure that it doesn't cross the grout line, because then that's going to create the seals, and not so good of a seal. It'll break the seal. But that's really simple, getting in and out with a grab bar. Consider the height of your toilet. If it's too low, you could use a raised toilet seat. That's another thing that's easy to get, or put grab bars by your toilet. If something is low, it's going to be harder to get up from. You're going to have to really, really use your muscles. So make it easier for yourself. Have a higher toilet. They have toilets now that you can install that are actually not the standard height. They're a little bit higher. But if you have a standard toilet, you can buy something at a store, a raised toilet seat. They have all different kinds. They have ones with grab bars. They have ones without the grab bars. Really, really simple. And consider a shower chair and a handheld shower head. I think a shower chair, they come in all different shapes and sizes. They have ones that are a little fancier. They have plastic ones, but you can take a break when you're in the shower. If you're feeling lightheaded, you can sit down. And then the handheld shower head is, like, I think, one of the best things you can get, because you could sit while you're taking a shower and use the handheld shower head, and it just makes things easier for you. So these are just a couple of things that you can get for your home. And this is just, a few of the very, very many that you can get. But we thought it would be good just to show you some. So in picture A, you want to think about the outside of your house too. How easy is it for you to get in and out of the house? With the snow too, you want to make sure, you can get in and out safely with the ice and everything that we have going on now. So in picture A, you can see there's 2 handrails, much easier to get in and out. In picture B, this is just one of the many different grab bars you can put in your shower. They've got really fancy ones now, and this you can see is right around the faucet there. So that's something you can get. C, I love this one. It's a tub transfer bench. So if you have a tub insert and it's hard for you to step over the tub to get in, and you don't really want to put in any grab bars, this goes in on the outside, as you can see, and then also on the inside. So what you do on this one is you sit on the outside part of the bench, and then you just put your legs over as you're sitting, and you scoot yourself in. And then if you have a handheld shower head, it's perfect, because then you could just take that and wash yourself with it. Another one of my favorites is a bidet. So easy. If you're having trouble, and a lot of people do, with their balance and being able to do personal hygiene, this is such a great option. And I know they have them at Home Depot and Lowe's. You can put it on an existing toilet. They have different, where you can clean. They have dryers. It's just like the coolest thing, and it's not overly expensive either. E is just, think about if you are doing any home modifications, if you're redoing any of your rooms in your home, like, where are you putting the outlets? Could you access them if you're in a wheelchair? So just things to think about. F is a roll-in shower, like we call it, or a walk-in shower where there's no lip or anything. You can literally just walk right in, and you can sit. They even put a bench in there. And then that is an example, the toilet too, I wanted to show you of just having some grab bars attached to the toilet. So you don't have to put anything into the wall. And then the last one, this was actually something that was designed by a physical therapist that you can, rent and buy for your house if you don't have a walk-in shower on the level that you're staying on. It's actually a shower, and it attaches to the faucet in your bathroom so that you can get water, and you could roll in, that's a roll-in shower chair with wheels, and you could roll in there and wash yourself. There's a handheld shower head. There's so many options, but I think, it's important to remember good lighting, reduce your clutter, and accessibility. Can you access the things that you need to get to without falling or without having to walk, too far? So just to switch gears a bit, there's something that we offer here and is offered all over the place, is personal medical alert devices. It's a really great option, if you're living alone or, even with somebody and you just want to have that safety that you can hit a button if you need somebody right away. So just some statistics, the mortality rate from falls has been determined to be 67% when lie time, so when you're down on the ground for more than 72 hours. This is just detrimental. I mean, you can get something called rhabdomyolysis, where you become septic, and there's toxins that get into your body. You can get a urinary tract infection, a fracture. I mean, it's you just don't want to fall, right, and be down for a long time, as opposed to 12% when you're on the ground for less than an hour. So the rate, the mortality rate is much higher when you're on the ground for much longer. Of the patients found alive, 62% were hospitalized and approximately half required intensive care. Of the survivors, over 60% were unable to return to independent living. So just one fall can really change your life. A medical alert system can create a level of safety, just a touch of the button, by delivering fast medical support. So without a personal medical alert device, fall help, might come within 2 to 72 hours, but with a medical alert device, you can get help immediately within 22 seconds of a fall being detected. So we have Lifeline, that's the service that we use, and we have a lot of different options. There's ones that you see that you can only use in your house. There's ones that will detect if you fall and you're unconscious. It knows that you've fallen. It will automatically call 911 for you. And then there's also on-the-go options. So there's like a GPS tracker in there. So if you're at the library or the supermarket and you fall, you can just hit that button and it'll know where you are. So a lot of different options. And that's it.
Thank you so much. So much information, very helpful. So if anybody does have questions, we'd love to take them now. You can put them in the chat, or you can also put your name in the chat and we'll call on you to ask your question. But I do have a question. Melissa, you gave a lot of home improvement ideas there. And if somebody has limited money, what would be your first investment to help prevent falls?
Oh, that's a good question. I think, like I said, looking at accessibility and things in your home, that you could change without having to spend much money, and like the carpets, like for example, removing the carpets that the throw rugs and things like that. Like, what can you do? What can you change? What can you take away in your home that will make it a little bit safer? And then a lot of the adaptive equipment things that I had mentioned, like a raised toilet seat or the tub transfer bench, those things aren't very expensive. So you can certainly do those without having to make any like grand home modifications.
Good to know. Thank you so much. And then also, Gigi, are there services or companies that will implement home safety inspections and improvements?
Say that again. It cut out. I'm sorry.
No problem. Are there services or companies who will implement home safety inspections or improvements?
So I think the question is, is there someone that can go out and look at someone's home and make recommendations for that? And it's something that we can do. Absolutely. We do that. I know Melissa does that. We can go out. Sometimes people even ask us, they're looking to make renovations to their home, and they know they want to age in place in their home. What would we recommend to, you know, how would they do
Like
their
to think
bathrooms?
ahead, to
To
think
think
ahead for
ahead.
the future.
Yeah, so we've consulted on some of that as well. So I mean, that is the best thing, if you know you want to age in place in your home, to really set yourself up for success for that. And it's worth, and there are a lot of modifications that you can make to a bathroom where it doesn't look like it's institutional. I mean, the stuff out there is so nice, that you can set a beautiful, you know, handicap accessible bathroom, or a bathroom that you like, walk-in showers and all those, where it is absolutely beautiful. So so don't think that if you want to make these modifications that it's going to look institutional. It doesn't have to look institutional. And there are you know, recommendations for that. I don't know of any other, I'm sure like general handymans have those kind of recommendations, but I don't know of any personally that could go in for those, for aging in place.
Okay. It's good to know that you'll do an assessment. That
Yes.
RVNA can do that. That's
Yes.
great to know. Thank you. Also, this is a question, how can one get a response to a fall in 22 seconds? Maybe if one is in a nursing home, but if you're in your house, home alone, how can that really happen? Especially when you think of Reading being so rural, the windy wooded roads. So how does that work?
So you get a response right away from the Lifeline, you know, the person who's on the line. Like they will right away say, how are you doing? Are you okay? Have you fallen? And then as they're doing that, they're calling 911 for you. So obviously the response time from the ambulance will vary a bit, but you're going to hear from someone immediately.
Okay. So you'll have contact with somebody. And do they stay with you?
Yeah. Oh yeah, they will.
Keep checking in with you.
Yep.
That's good to know. Also, we're getting a lot of questions about your wonderful slides and all the information on them. We are recording today's program, so those slides will be available on the recording, and you'll be able to go back to it as many times as you want, to look at them and to take down the information. It will probably take a couple days to up to a week before that recording is available. It will be on the Mark Twain Library website, and on our homepage there's a link to the YouTube channel. So you just click on that link and you'll be able to find the program. It'll be under health. So you can look for everything there. And then back to some of our other questions. I know there's some questions about the Otago Balance program. And do you have resources for that program?
So we have a series of exercises. So I don't know by resources. So it's a program that you can kind of start in your home with the guidance of a therapist, and then it kind of continues where you become independent with it. So and the therapist kind of, you know, does the assessment and kind of develops the program for you, and then the goal is for you to be, you know, to be a community, to do it in your own community, in your own home, and that kind of stuff. So
about how long does it take for someone to go through that program?
The first, it's actually a 6-month thing, and then it actually goes for a year, because then there could be like a check-in once a year kind of thing. But initially it's about a month or 6 weeks of just it starts off a little bit more intense, and then it goes down to once a week, and that kind of thing. So there's kind of a progression to it. So in general, it's about a month or so.
Okay. Will insurance cover
if yes? So if it's part of the Medicare, if it's part of the physical therapy program, yes. Otherwise, unfortunately, we will be getting back into doing some group things and that kind of stuff. But so if it's part of a physical therapy program, yes. Sometimes we start it for in our home care service. The therapist will start them on doing the exercises, and then as they progress out of home care, sometimes then they'll come into our outpatient and kind of get a little refresher, and maybe starting a couple times a week, and then once a week, and that kind of thing, and then work into the community.
Wonderful, wonderful. And is it something you can do yourself online?
There are the exercises are out there. If you Google it, it's just going to give you the whole gamut of them. It won't give you, that I know of, an individual program for what is specific for your needs, but you can. And we also have on the RVNAhealth, if you go to the Rehabilitation and Wellness program website, we do have some of our Ontago exercises there.
Oh, good. Very good to know. Thank you. And there were a couple questions about Lifeline. And we talked a little bit about it, but I guess there's a question about how expensive is it? Is it affordable?
Yeah, so that's a good question too. So depending on which option you choose, if it's the one that can only be used in the home versus the one that you can use out in the community, it's anywhere from like $35 to $65 a month.
Good. All right. And any other questions out there from everybody? Feel free to put your name in the chat. You can unmute yourself to ask a question. It's wonderful that we have RVNA here with us to answer all these questions. We want to take advantage of that. One last question that I have is about dizziness. And are there programs to help people with dizziness?
So yes, there's many forms of dizziness. So it would really need to be diagnosed to what is causing the dizziness, because like we said, there's orthostatic hypotension, which is a whole different thing than vertigo. So you would need to be evaluated to really determine what is causing the dizziness. If it's vertigo, we have therapists that are vestibular certified and can run through a whole series of assessments and exercises to help with the vertigo. But you need to be kind of evaluated to determine whether if it's a true vertigo or if there's other means of causing of dizziness. And like we said, it could be medication induced. So there's different things. So it needs to be evaluated. But yes, there's a lot you can do for dizziness and vertigo.
Okay, thank you. Anyone else have a question out there? I think we really appreciate you taking your time, Melissa and Gigi. It's been wonderful to have you with us. So helpful, so much information that we can use throughout time, and always go back to it. So it will be on the website. So thank you so much. And I want to thank the Commission on Aging for co-sponsoring this program with us. And we look forward to doing more programs with them in the future.